Or there is another option, which is accelerate the process and jumpstart the process in a fast manner by collaborating with an advanced nation such as South Korea in AI, and then accelerate our adoption of this technology in a fast pace, and then we'll go from there. So we opted to go with the latter. Pleasure. My name is Raed AlHazme. I'm the Chief Information Officer at the Saudi Ministry of National Guard Health Affairs. I'm also an assistant professor at the King Saud University for Health Sciences at the Health Informatics program. Within the Ministry of National Guard Health Affairs in Saudi Arabia, we have a chain of hospitals and primary healthcare centers. We mainly serve the National Guard service members, but we also serve as well large segment of the population. My role as a Chief Information Officer is to oversee the IT services across all of the Ministry of National Guard, Health Affairs, hospitals, and primary healthcare. The healthcare system in Saudi Arabia is similar to many other countries. So you have three divisions, key divisions within the healthcare system. So you have the government, part of the Ministry of Health, and you have the government that's part of the military, and you have the private sector. When it comes to the government part of it, it's within the Vision 2030 to transform the government healthcare system into an accountable care organization, which is a very powerful model, has been proven worldwide to provide a service per or a fee, a service that's provided based on performance. So it's not based on a fee or financial incentive. But this kind of model requires some sort of support for it to be implemented, mainly support by IT. So that's why a key component of this transformation within the healthcare sector within Saudi Arabia is basically digital health. And we have come along the way in the government sector when it comes to digitizing many of the hospitals that we have. Within the Ministry of National Guard Health Affairs, we have reached a level where all of our facilities, so we're talking about around 80 facilities between 5 hospitals and 70 plus primary healthcare centers scattered across the kingdom, all of them connected with one unified. Part of the Vision 2030 of the kingdom, where many segments of the country is being basically transformed in a certain way. And one of the segments is basically healthcare. And the kingdom is improving the healthcare sector in a manner that would improve the quality, it will increase the patient safety, it will make the healthcare system more efficient. So there will be a lot of cost saving, which is a major issue worldwide in healthcare. And also it will make healthcare more accessible within the kingdom. It's actually part of a memorandum of understanding that the Crown Prince, His Royal Highness Prince Mohammed bin Salman, had signed with the counterparts of South Korea in 2019, which targeted basically the implementation of artificial intelligence in healthcare using collaboration and partnership with South Korea. And out of this, we did launch the first project that I just highlighted, which basically got completed a couple of months ago, and we're ready to launch it and go live with it within the organization. Again, we're also looking forward to launch additional projects. And again, I think with AI specifically, since its quality as technologies relies heavily on the variety of data. I see these kind of collaborations very important. For us as MNGHA, this kind of collaboration with South Korea was important because when we wanted to launch our AI program in 2019, we had two options. So one option is to implement and establish the program from scratch, similar to what entities within South Korea had done probably 10 years ago, way back, and they have gone through the learning curve and the development journey probably a decade ago, give or take. So that was one option for us, to start from scratch and wait for about 10 years for us to reach this level. Or there is another option, which is accelerate the process and start the process in a fast manner by collaborating with an advanced nation such as South Korea in AI, and then accelerate our adoption of this technology in a fast pace, and then we'll go from there. So we opted to go with the latter. We are very familiar with Dr. Ansel solutions. Actually, in the year 2020, last year, and during the pandemic, at the height of it, we did actually launch a project with South Korean partners, to name a few. So the National Information Technology and Promotion Agency of South Korea, Easy Care Tech, SNUBH, VNU, and some other partners. We did launch a large artificial intelligence project. And part of this project is basically the update, training, development, and in the end, the goal of implementing Dr. Ansels. And some of the focus areas that we have targeted as part of Dr. Ansels are 5 diseases. And they are basically common kind of issues in healthcare globally, but we are basically also having this as a challenge. So those diseases are Alzheimer's, brain stroke, colonoscopy, coronary artery calcification, and epilepsy. And what we have done over the last year or so is basically capturing data within our organization, mashing up data, preparing the data, again, all in collaboration with our South Korean partners. And we did update the models, retrain them, and we have reached the point that those models are ready for in 2015. We did actually acquire and launch our electronic medical record system, replacing a legacy system that we had. And this has increased the paperless level within the organization from lower 30% to almost 100% within a year and a half. We did actually implement the best care solution from South Korea after customizing it within a year and a half, less than 2 years, across all of our 5 facilities, large hospitals, and 70 plus primary healthcare centers. So going through this exercise of transferring very significant and very sophisticated technology, which has shown a huge kind of positive impact, is not new to us, collaborating with our South Korean partners. Well, one of the key challenges is you really want to improve the quality of the healthcare care that you are providing to your citizens. And the 5 diseases that we targeted in the projects that we had worked on target just that. So let's take, for example, Alzheimer's. One of the key issues of Alzheimer's is you really want to detect this disease at an early stage. which provides a better chance of tackling this chronic disease. The AI model from Dr. Answer that helped diagnosing Alzheimer's from MRI images provide this capability. Human eyes have limitations in the end, and humans are basically prone to errors. And to maybe quote the paper that the Institute of Medicine had published in the early 2000s, to err is human. That's the fact of the matter. So probably one of the ways to overcome this limitation that we have as humans is to rely more on machines, on jobs that machines do perfectly, usually, which is doing routine kind of processes and the ability of capturing very small intricacies in the data that we have. And with Dr. Answer's AI model, where it could actually scan and analyze those MRI scans and images and identify if there is an early stage of Alzheimer's or not. Even if we catch, let's say, 1% of the false negatives that our physicians couldn't basically identify, which is common across the healthcare globally. I mean, there is always false negatives, but false negatives in non-healthcare industries, it's a little bit tolerable. I mean, false negatives in manufacturing, the worst case scenario is you get a faulty part, which you could replace. But a false negative in healthcare, especially with chronic diseases such as Alzheimer's, is basically very harmful to the human. So even saving one life is worth it for investment in such technologies. Well, the sky is the limit when it comes to AI. The good thing about Dr. Answers is it's basically a platform. So it's not limited to those 5 diseases. So we're looking at other kind of diseases that really impacts the quality of life of patients, not only in our setting, it's basically genetic kind of challenges. So one of the future projects that could basically add it is basically identifying and diagnosing issues in the retina for diabetic patients, so retinopathy screening. As you know, diabetic patients would have usually issues in the retina along the way, and you really want to scan those patients regularly. And if you have large population, scanning those retinas on a regular basis would be very challenging. Again, you really want to avoid false negatives in this case. So one of the potential, again, and that's just an example, there are so many other similar examples, especially in the screening programs, which the healthcare would need a lot to implement the preventive element of it. Healthcare is very good nowadays worldwide in treatment and intervention. But when it comes to prevention, there's a long way to go. Screening could help a lot with this. Circling back to the retinopathy screening program, so you get those tens of thousands of retina images coming from the primary healthcare physicians. And there's no way that a country would be able to allocate consultants, ophthalmologists, that would be able to read all of those on a daily basis. This is a lot of a workload that no institution or a country, for that matter, could handle. So that's a prime candidate for an AI layer that would stand between those images, the raw data, and the ophthalmologist. So this AI layer is going to eliminate, which is usually that's the case. So 95% of your patients of the data would basically be true negatives. There is no issue with the retina, but they will overload ophthalmologists if they take on those images. But if you have this AI layer, it will eliminate those 95%, and this 5% would be carried over to ophthalmologists. They will basically analyze them further and take care of the patients. Again, screening programs, huge potential for AI, and Dr. Answers could play a major role in this. For the South Korean audience, I just want to highlight that these kind of global partnerships are really key for the whole humanity. Well, again, I mean, the fruitful partnership has been very beneficial, and we look forward not only to keep the pace as is, but to improve the pace that we have been going through. I can't thank enough, actually, Easy Care Tech, SNUBH, as well as Dr. Wang and his team for all what they have done over the years. We had taken on major challenges. I mean, the LIS project, which we launched in January 2020. So it was, if we want to pick the right time to implement and actually develop from scratch, not only implement, a highly sophisticated lab information system and tertiary healthcare system, you wouldn't pick 2020. So we did actually embark on this project in January 2020. Before the end of this year, the development was completed and the system was up and running across all of our facilities. So again, I can't thank them enough for this great partnership and for the collaboration. And we look forward to improve this partnership.